Our Deputy Premier and Health Minister Sylvia Jones defended the province's response to the ongoing pediatric healthcare crisis. She says the Ford government was ready for the surge in patients and claims pressures are easing up. Jason Gaidola has the latest.
As hospitals continue to grapple with fewer workers and high cases of the flu, RSV, and COVID-19, Health Minister Sylvia Jones says the health system is showing small improvements.
I'm not going to presuppose that that means we are coming to a plateau, but we are seeing a slowing down of the percentage increase.
During a funding announcement in Toronto, Jones claims the Ford government has ramped up capacity in pediatric ICUs by 30%. As of today, units across Ontario are now caring for 114 children, 2 more than the health system can handle. That's fewer patients overall. Last week, Critical Care Services Ontario released data showing that there were more children in intensive care units than there were in beds, adding that 122 children needed critical care.
Frankly, it's a moving target. It goes up and down depending on how many are discharged, how many are moved to a community hospital. The people of Ontario reassurance that if your child is sick in the province of Ontario, you are going to get the health care you deserve and you need in a timely manner.
Earlier this week, Hamilton Health Sciences said it received more than $1 million to help with critical care surges at McMaster Children's Hospital.
And we're using those funds in a number of different ways to ensure that we have appropriate pathways for children and youth who may not require the highly specialized care of the McMaster Children's Hospital Emergency Department.
Jones also says more than $180 million will be spent on upgrades to hospital infrastructure and utilities. However, inside the legislature today,
the Minister of Health yesterday told us the province had planned for this surge of illness and put policies in place to protect our children. We just heard that repeated. But if this was a plan, it was a terrible one.
NDP opposition leader Peter Tabuns and others took aim at the funding and says it's needed in ER.
We're not seeing any announcements, not an extra dollar for those operations, which is outrageous. And the minister comes out and tries to change the channel on what's going on in healthcare.
That's an announcement that gets made regularly every year. It's what you have to do. You got to maintain your house, right? You got to maintain your hospitals. Right now, it's evident that there is no plan for the crisis that exists in our healthcare system.
Earlier this morning, Jones noted that RSV is the dominant illness being seen in children's hospitals. She's also urging primary care doctors to take on more child patients to help families avoid going to the ER.